So contact tracing has been an activity that public health has conducted since John Snow discovered a cholera outbreak in like the 1800s. This is one of the cornerstones of how public health has been able to control the transmission of infections since the beginning of public health time. So this is not something that we are dealing with just now that we have COVID. We conduct this activity with all reportable conditions that are infectious and transmitted from person to person. And so I like to call it a contact investigation because the word tracing, it just has this connotation to it that we really do have targets. That isn't necessarily the case. The intent is for us to be able to determine what the magnitude of exposure was for someone who is infectious, and the number of people that they may have come in contact with during their infectious period. And so when we do reach out to an individual who has tested positive for COVID-19, we ask them questions about when their symptoms started so that we can calculate their infectious period. And then we say, okay, during your infectious period, when, who did you have contact with? Who are your household contacts? Are any of your household contacts high risk for severe infection? Because, we would want to make sure that these individuals that are high risk definitely have access to the resources that they might need for intervention. And we also ask about other community contacts. So did you attend any events when you were pre-symptomatic, for example, which most people do. If they're not feeling ill, then they might go to a backyard barbecue over the weekend, or they might go to a birthday party because, they don't feel sick. But they were infectious. And so once we are able to determine who has been exposed to that infection, we will ask for contact information for those individuals so that we can attempt to get a hold of these individuals who have been exposed to notify them that they really do need to be monitoring their health, especially during the 14 days after their confirmed exposure. They could develop signs and symptoms for COVID-19, and if that happens, we do recommend seeking testing, but also during that time where they're monitoring their signs and symptoms for that 14 days, we do also recommend that they quarantine, so they stay home as much as possible. If they have to leave, it's with a mask. If they have to leave the house for grocery shopping or other essential activities, that they make sure that they are wearing a mask to protect others around them. And it is an opportunity for us to establish relationships with individuals who are now considered high risk for developing infection, because if we have that relationship established, we can already be preloaded with things like, here are the resources you need if you do become symptomatic. And here's the guidance that we would provide to you if you become symptomatic. Everybody's always worried about, the kids in their household or their grandma that's living in the household. Those are always the next level questions that we get. And we can rapidly get our high risk individuals information about what they need to do next. And it does just help alleviate some of that panic if and when those symptoms develop. The other thing is, we do know that there is, in younger populations, a higher rate of mild infection. And so if we have exposed individuals that do develop symptoms, they may not have it in the forefront of their mind that, oh, this cough might be COVID. And so if somebody has that tip off that, hey, I've actually been exposed, and if I do develop any of these symptoms during this time frame, then I really do need to be more cautious about the places that I'm going and the people that I'm seeing, and my mask wearing and all of those things, hand washing. And so the process is really not to intrude or to gather inappropriate information about individuals who have been exposed. The intent is to be able to provide education and resources for people that are now high risk for developing infection.